Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Schmitt, and with me today is Dr. Melvin Sanicas. Good morning, Melvin. Good morning to Switzerland.
Good morning, Professor Schmitt. Good afternoon or good evening to those who are watching us or listening to us today.
The topics today are shingles and a higher risk for memory loss. We then cover the Mpox outbreak in Africa, and that is declared by the African CDC and also by WHO. And then I will show you a couple of slides on basics you should know about monkeypox. Let's get started with an interesting article about shingles. Melvin, what's the story here?
Yes, so this is an observational study in Alzheimer's research and therapy, suggesting that a single episode of shingles is actually tied to a 20% higher risk of long-term confusion and memory loss. And it further supports receiving the vaccine against the disease, right? Shingles, also known as herpes zoster, is a painful rash caused by the same virus, varicella zoster, that causes chickenpox. After chickenpox infection, the virus remains in the body for life and may reactivate even decades later. And nearly all Americans aged 50 years or above have had chickenpox and are therefore vulnerable to shingles. And so this is a study from Brigham and Women's Hospital, and it looked at over 145,000 participants in the Nurses' Health Study and the NHS2 and the Health Professionals Follow-Up Study, HPFS, to really assess the link between herpes zoster and subsequent subjective cognitive decline. And the team compared 3-unit increment changes in the subjective cognitive decline scores among shingles patients by years since the shingles episode with those of uninfected participants by looking at the results of medical records and health status surveys administered every 2 years. And I think it's really interesting, right? Because it shows that from these three large independent cohorts of women and men, herpes zoster was associated with a higher long-term risk of subjective cognitive decline.
Very interesting. So this was an ongoing prospective long-term study, or these were such studies, right? Three independent studies.
Using 3 independent cohorts.
Okay. Very nice, a good piece of information and a good argument. And there is a highly effective vaccine available today, as you mentioned. Melvin, now let's cover monkeypox. I guess this is what everybody is reading about these days. And what is the story from Africa?
Yes, so the Africa CDC last week declared the first public health emergency of continental security, or the PHECS, because of a complex and worsening Mpox situation in Africa, especially a surge in the Democratic Republic of the Congo that partly involves a novel clade 1b virus. So the declaration came ahead of the meeting of the WHO Emergency Committee, which also discussed the situation, whether this warrants a public health emergency of international concern. And in this picture here in the slide, you see the South African virologists and epidemiologists who chair the Africa CDC Mpox expert group discussion. This is Dr. Salim Abdul Karim. And basically, he said that the committee acknowledges that surveillance data are limited, but the data they have is enough to declare a public health emergency of international concern for regional concern for Africa. And this is because case numbers have been accelerating over the past few weeks, and the upward trend is really concerning. And the case fatality rate in the 3% to 4% range is higher than the expected case fatality rate, and it's considered too high, with fatalities concentrated in people with HIV.
Yeah, so I think this monkeypox outbreak really hits a population at high risk with many HIV positives. Mm-hmm. And they have, as I show you later, they have a higher risk for severe disease and of dying, certainly. Yeah. So this is of concern, and maybe one can mention that they're also looking for help and for support from outside Africa, particularly when it comes to vaccine doses, right?
Yep.
Very interesting. And that was then followed by a WHO declaration.
Yes. So the WHO Director General, Dr. Tedros Ghebreyesus, um, he declared basically on the advice of the Emergency Health Regulations Emergency Committee of the independent experts of the WHO, who reviewed the data from the different parts of Africa, especially the DRC, right? And the committee informed the Director General that it considers this upsurge of Mpox to be a public health emergency of international concern. And just to note, this is the second time in 2 years relating to Mpox. So, as we know, Mpox is an orthopox virus that was detected many, many years ago in 1970. But it was only in July 2022 when we had this multi country outbreak of Mpox when it was declared a public health emergency of international concern. And then the public health emergency of international concern was declared over in May 2023 after there had been a sustained decline in global cases. And now this is again the second PHEIC determination for Mpox because of the upsurge of the number of cases in DRC.
To stay there a little bit, this is driven by a new type of the virus or by a little bit mutated virus. Am I correct?
Yeah, the rapid spread of a new virus strain, the clade 1b, which really appears to be spreading mainly through sexual networks. And its detection in countries neighboring the DRC is also concerning because it's also spreading through sexual networks as well.
Thank you, Mel. Very, very interesting information. And what I did, I summarized what we know about orthopox viruses. There are basically 4 orthopox viruses that cause human disease. The first one is the smallpox virus. It is called variola virus. And from that, or very related, is the cowpox virus. And very occasionally, if you're in close contact with a cow with cowpox, then you may have localized skin ulcerations, local diseases on the skin. And again, generally discovered if you have had cowpox and have been exposed to cowpox, you will not come down with smallpox. So that was the origin of vaccines and vaccination in the 18th century. Now, Jenner used then the cowpox virus to vaccinate, and over time, many countries adopted this cowpox vaccination, and with time, the vaccine virus changed. And in the end, it became what we now know as the vaccinia virus, which would only cause local vesicles on the skin. And that has been used for vaccination against smallpox until some decades ago. So many of us who are alive today and who are above a certain age, they have been vaccinated with the cowpox, with the vaccinia virus, and you can see that by a scar on the upper arm of the respective person. So I've been vaccinated with that virus. And now recently, people have always been predictive. If you stop vaccinating against smallpox, what may happen is that animal pox viruses jump to humans, and that is exactly what happened. Initially, particularly company people, claimed that may happen because they certainly wanted that their vaccine continues to be used. But in the end, they were right. This is exactly what happened. And if or not the vaccinia virus would have been able to prevent the outbreak, we don't know. But we discuss later a little bit, about the vaccine strains used today or the vaccines used today and the Mpox outbreak. Melvin, any insight from you on this slide?
I think this is a very useful summary of the different orthopox viruses. We sometimes are not so clear about which one is which, but this is a very good summary for that.
Yeah, I agree. It's from our Vaccine Tutor, from our uh, online program on vaccines and vaccination. Now, this is a nice summary from a journal I've never heard before, Signal Transduction and Targeted Therapy. This is the summary on how Mpox works in the end. The reservoir is monkeys, small rodents, and like squirrels here. If you are, as a human being, in close contact with an infected animal, you may get infected and then transmit the virus direct contact. Or if you are pregnant, you may be able to transmit it to your unborn. What I learned very recently, there is also transmission if you are in close contact that is not a direct skin-to-skin contact. But it seems to be possible that you can get the virus via the respiratory route or from not so close contact. The symptoms are listed down here on the left side. They are usually mild with fever, fatigue, headache, myalgia, like another viral infection. But in the blue bars, what you can see, if you're immunocompromised, you get more severe disease. And if you're immunodeficient, you may even die from Mpox infection. That is due to CNS infection, due to septicemia, due to myocarditis, pericarditis, and so on and so forth. So it is a severe systemic disease, particularly if your immune system is not on top of its performance. Melvin, any insights on that one?
Yes, this is a very good summary because I think most of us now, because of the news, we're just thinking that this is really skin to skin contact, which is correct, but there are other ways of transmitting the virus.
And just, I guess, in a highly densely populated area in Africa, you are more likely to transmit the virus because of the density of the population living together. The transmission modes are summarized on the slide. Again, I don't go into the details here. It's animal to human. It is person to person, skin to skin. And this is what we saw in the Western world: vaginal or anal sex, close contact during sex, kissing, mouth to skin contact, face to face contact. And this was new to me: face to face talking or breathing, and respiratory droplets. So this is something you have to be aware of as of now. The virus enters the body through broken skin, mucosal surfaces, or the respiratory tract, and also through contaminated objects. Melvin, any comments on this one?
Yeah, like the previous slide, it's good to remind everyone, right, that there are other routes of transmission. It's not just person to person, skin to skin, but it can be transferred to other ways, as mentioned in the slide.
Yeah. Now, what I found on the WHO website is this slide with showing the vesicles, the monkeypox vesicles, and different from chickenpox. And Melvin mentioned that earlier. In chickenpox, you see different stages of the lesions at the same time. You see papules, you see vesicles, you see scars, you see redness. With the pox viruses, you only see one state of the lesions. They're always vesicles, or they start as a papule, so they're always in the same stage. Now, the new information for me here again is the division into different clades. And maybe, Melvin, you can help me here. 1A is the endemic in the Democratic Republic of Congo and Central Africa, affects mostly children, various modes of spreading. This has been around and known for decades. 2 is now 1B, with the current outbreak in the Democratic Republic of Congo, largely adults, spreading predominantly by intimate contact, sexual networks, less other routes. Correct? This is what we have been knowing, right?
Mm-hmm.
Then there is 2A, endemic in West Africa for decades as well, low incidence, various transmissions routes like clade A. And new to me is clade 2B. And I only found this on the WHO website. This is from a global outbreak 2023 that we saw in the Western world, where affected patients were largely men having sex with men. Melvin, any comments on that one? Any other insights?
Yeah, I think these differences actually really emphasize that while both of these clades cause Mpox, right, clade 1 is generally more severe with a higher case fatality rate, while clade 2, particularly 2B, has shown broader global spread. So I think while the clade 2 is, shall we say, less severe, it's able to spread to more people. So I think it actually makes sense.
I guess another learning, if viruses jump from animals to humans, it's unpredictable how they evolve, right?
Mhm.
So this is another lesson learned, like from COVID, right?
Yeah.
Here again, Melvin, maybe you can comment on this one. This is a European Center for Disease Control chart, and they show the distribution of the different viruses. And again, you see the clades 1 concentrating in Central Africa, and the clade 2 in Northern and Western and Southern Africa. Any comments on that, Melvin?
Yeah, so clade 1, as you mentioned, Professor, it's associated with Central Africa, particularly in the Congo Basin. And 2A and 2B, it's primarily associated with Western Africa. And 2B is also linked to the 2022 global outbreak that had the first public health emergency of international concern, which was tracked to cases that initially came from Nigeria. And so I think these are the major difference in terms of geographic distribution.
Thank you. And I have no insight on the gray countries. I cannot really believe that there are no cases in the gray areas here in Africa. So this is something to watch.
In influenza or RSV surveillance, Professor, right?
Yeah.
No data doesn't mean there are no cases.
Yeah. Actually, maybe one should even say no reports, right?
No reports.
Yeah. All right. This is just, and I won't go through that slide, it's complex. It is just showing that there are options for therapy depending on the licensing situation in your country. There is, for example, immunoglobulins that may prevent the infection of single cells. Then there are different types of drugs that are involved in the entry and in the replication of the virus and the production and the assembly of the virus in the cell. Tecovirimat has been licensed, and there may be other licenses like cefitinib. There may be licenses depending on your country where you may or may not be able to use available treatments, particularly for those who are immunodeficient or immunocompromised. Then we come to prevention. In the end, again, there is a vaccine that was originally developed to prevent smallpox. And it has been shown before with the outbreak in the Western world, here from the United States, that vaccine efficacy with 2 doses ranges from 66 to 86% in different studies. If you use 1 dose, it is 10% lower, ranging from, or, here in this study, from 36 to 75%. So it depends a little bit how you do the study, what the population is, and maybe some other variables of the study type. But the important information is, and that brings us back to my very first slide on monkeypox, that this is all orthopox viruses and they are related. And apparently the Bavarian Nordic vaccine protects against this Mpox virus. And just as a reminder, the American trade name of the vaccine is Jynneos, and the European license name is Imvanex. But from all I know and from the looking at the package inserts, these vaccines seem to be identical for me. There may be some small differences that I didn't pick up, but basically this is the same vaccine.
Yeah.
Elvin, any comment on vaccine effectiveness?
Not on the vaccine effectiveness specifically, Professor, but I think because you mentioned therapy, right? Just to remind our viewers, our listeners, that with Mpox infection, most patients recover with basic supportive care, including pain management, fever control, and hydration. And the skin lesions that you've seen in the slides, they are managed with antiseptic care to really prevent secondary infections.
Very important. Thanks for this addition. Yeah. So supportive care, good supportive care is really important, even if you have no other therapeutic options. Yeah. Very good. And that brings us to close today for the Mpox situation. We discussed shingles and the higher risk for memory loss and confusion after you had shingles from 3 independent cohorts, large number of study subjects. We spoke about the declaration of a public health emergency for Mpox in Africa and globally by WHO. And then we told you some of the very basics of Mpox. And with that, I guess we come to the last slide for Melvin.
Yes, so this is just a cartoon showing the difference between managing and being a leader, so management and leadership. So management focuses on organizing, planning, overseeing daily operations to achieve objectives, right? So that's important too. But leadership is about inspiring, guiding, and influencing other people towards a shared vision. So I think both of them have roles in organizations, in groups, and we should be able to develop management skills and leadership skills as well.
Thank you, Melvin, for this insight and this high-level concept. I like it very much. Thanks, everybody, for joining us. Hope to see you again next week. Bye-bye.
Thank you, everyone. Stay safe.